I was the keynote speaker talking about challenges and pitfalls of pediatric and young adult oncology trials over the years. The title in the program says just CAR-T trials, but it was actually across oncology, including my experience in academic clinical practice, which was many years before joining Novartis close to 7 years ago. I'm hoping that they will become more patient-centric, patient-friendly, utilizing perhaps some degree of AI, but making sure to keep the human component there, and working more closely with the health authorities and doing things in a little bit more timely fashion, given the treatment landscapes are evolving so rapidly now. That's my biggest concern, is by the time the trial is implemented, the treatment landscape has already evolved significantly and can be challenging.
One of the things I talked about yesterday was the changes in the FDA, the new administration with a new president, new head of all the departments. The FDA has to deal with that. You know, what evidence do you look for? How do you evaluate safety? How do you evaluate efficacy? Particularly when you talk about cancer trials, which are very long, and they can easily take years. And so for a drug company, it's just impractical to enroll somebody and 2 years later start the next one, 2 years later start the next one. Even if you're starting 50 people at a time, if the trial's gonna go for 20 years, that's just not an effective way to introduce drugs. So part of the accelerated trials allow you to say, we know that if, for instance, we can show that the tumor is shrinking, that's a good sign. I have some personal family experience where a family member had a cancer that was the size of a tennis ball, and he's one of the first CAR-T patients, that shrank to the point where it was invisible within a year. Those sorts of endpoints, it doesn't have to be that dramatic, but if the drug sponsor can show benefits and show that to the FDA can say, this looks promising, we'll approve this so you can give it to more people.
I think digital twins and this idea of assembling unstructured data in a way that allows us to make decisions clinically is a very evolving and growing field. You know, obviously it seems a little bit space age to be able to turn everything over to a machine to make these decisions. But what we've done in just a very few limited cases at Sumitomo Pharma is we've taken all of the data we've generated within a clinical study. So this can be everything from efficacy to PK data, patient information that would be appropriate. And then even in addition to that, we take all of our preclinical data, which is really kind of where my area of expertise is. So all the data we generated through our animal models in the lab preclinically. And again, that can be efficacy, it can be any kind of information about, drug-drug interactions. It literally can be any kind of information. And this gets plugged into an artificial intelligence model, and it literally builds a digital twin for each patient in your study, or even theoretically future patients that you might treat that you haven't yet treated. And it allows you to run these simulations.
I think we've seen a lot of focus on innovation, a lot of focus in how to do more with less, and how to make budgets stretch this year, maybe a little bit more than in past years. But also a lot of excitement in the opportunities, and kind of like being forced to kind of go down this path of innovation, actually realizing that there's a lot more opportunity here than people may have realized or taken otherwise.
So I think once the technology will come in, then those variations which we see because of the cultures, because of the difference in stuff, will vanish. So that's why I think the technologies such as the AIs, such as the wearables, all the technology which are being used in the clinical trials with the digitalization, I think that will help us to advance the science forward.